Subdural Haematoma Part 1. The videos of SWOT Nurse Notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hey everyone! I'm Nurse SWOT, the owner of the channel. Today we will be looking on subdural hematoma. Let's begin. Did you know that subdural hematoma is also called subdural hemorrhage? Subdural hematoma, or subdural hemorrhage, is the buildup of blood on the surface of the brain. To be more detailed, the subdural space, a space between the dura mater and the arachnoid mater, membrane coverings of the brain, becomes filled with blood. This usually happens after trauma to the head. A closed head injury, to be more specific. There are two types: acute hematoma or chronic hematoma. Acute subdural hematomas is said to be the most serious type. Why? Because they're often associated with significant damage to the brain. Subdural hematoma causes a buildup of pressure around the brain. This leads to intracranial hypertension. Intracranial hypertension, often known as high intracranial pressure, ICP, is a rise in pressure within the skull. This is harmful because it can compress the brain, causing neurological problems. Okay, now what are some of the signs and symptoms of subdural hematoma? Feel free to type your answers in the comment section below this video. Common signs and symptoms include confusion, slurred speech, seizures, frequent falls, personality changes, frequent or worsening headaches, paralysis, usually loss of movement on one side of the body, fatigue, muscle weakness, problems walking, nausea and vomiting, numbness in the arms, legs or face, double vision, disorientation, loss of consciousness. Here we have a list of the types of assessment done for persons suspected of having subdural hematoma or diagnosed with subdural hematoma. 1. Mental status examination. 2. Vital signs. 3. Glasgow Coma Scale, GCS. 4. Obtaining a thorough health history. 5. Head-to-toe assessment, physical assessment. 6. Motor and sensory responses. 7. Cranial nerve examination. 8. A to E assessment. What are some of the surgical procedures done to resolve subdural hematoma? Feel free to type your answer below this video in the comment section. Now, some of the procedures done to resolve subdural hematoma are: 1. Craniotomy. This is the main treatment for acute subdural hematomas. What happens? A portion of the skull is removed, bone flap, after which the hematoma is suctioned and irrigated. The section of skull, bone flap, is then put back in place and secured using metal plates or screws. 2. Burr-hole surgery. The word speaks for itself. This involves drilling a hole in the skull, after which a tube is inserted to drain the accumulation of blood, surgical drain. At times the tube is left in place for days to drain remaining blood and to reduce the reoccurrence of hematoma formation. 3. Craniectomy. And yes, it is similar to craniotomy. A piece of the skull is removed, bone flap, however the bone flap is not put back in place immediately and secured using metal plates or screws. Why? Space is needed to relieve brain swelling. This, however, depends on how severe the bleeding inside the skull and the intracranial pressure, ICP. These are some of the common medications given for the management of subdural hematoma. 1. Anticonvulsants, used to prevent seizures. Example, the medication diazepam. 2. Corticosteroids, used to decrease inflammation. Example, the medication dexamethasone. 3. Antibiotics. Commonly used as prophylaxis or to treat infection. Cephalosporins, used to treat both gram-positive or gram-negative bacteria. Example, ceftriaxone. Glycopeptide, these class of drugs are bactericidal. Used to fight against aerobic and anaerobic gram-positive bacteria. Example, vancomycin. Now, why are antibiotics given? Well, this depends on what causes the head injury. Example, a penetrating injury causes a tear in the layers of protective tissues that surrounds the brain. This can cause bacteria to enter and cause an infection. Hence, it's either given to prevent, prophylaxis, or treat an infection. Here listed are common nursing diagnoses used for patients with subdural hematoma. Based on exam scenarios, this list provided can be used as a guide to easily identify priority needs when writing care plans. What to know? For the OSCE exam, complete a neurological observation chart. Assess the patient's neurological condition using the Glasgow Coma Scales, GCS, and note any changes in the level of consciousness. Monitor and record vital signs and neurological observations. Every 30 minutes for the first 2 hours, hourly for the next 4 hours, then 2 hourly thereafter until stable and GCS maintains to 15 out of 15. Escalate care if needed and give the rationale as to why. Continuously reorient the patient to his or her surroundings. For the assessment station, perform the following assessment: GCS assessment and complete the neurological observation chart. Vital signs: muscle strength and limb movement for arms and legs. Pupillary reaction. Now, how do you complete a neurological observation chart? Go to the channel, select and watch Subdural Haematoma Part 2. Thanks for watching. Remember to subscribe to the channel to get post notifications of more SWOT Nurse Notes videos.